Okay, so let's talk about arthroscopy, or as most of us know it, keyhole surgery. It has completely changed the game in orthopedic medicine. I mean, millions of people have this procedure every single year, and most of the time, it's a huge success. But what if I told you there's a hidden risk, a complication that can be absolutely debilitating for a patient and just incredibly frustrating for the surgeon? Let's get into it.
And it really is a success story, no doubt about it. The whole reason arthroscopy is so popular is because it's minimally invasive. We're talking tiny little incisions, which means less scar tissue, a crystal clear view for the surgeon, and for the patient, a way faster recovery time. It lets people get back to their lives, back to work, back to sports, so much quicker than old school open surgery.
So, with all these amazing benefits, you might be thinking, what's the catch? Well, even though it's incredibly precise, keyhole surgery isn't totally risk-free. And there's this one complication in particular that, yeah, it's rare, but when it happens, it carries some pretty serious consequences.
And we're talking about something called iatrogenic nerve lesions. It's a bit of a mouthful, but it basically just means nerve damage that happens accidentally as a result of a medical procedure. It's the kind of thing that you can't see happening because it's all going on deep inside the body.
And this quote from the source material, man, it really drives the point home. These injuries aren't just like a minor hiccup. They can be invalidating, causing long-term, serious problems with how you feel or move. You can just imagine the fallout from that, not just physically, but emotionally, financially, even legally.
So how does this actually happen? Well, it pretty much boils down to two main things. On one side, you have direct damage. That's when a surgical tool accidentally nicks or cuts a nerve while the surgeon is making the entry points or moving around inside the joint. Then, on the other side, you have indirect damage, which is a little more sneaky. This can happen from stretching a nerve, maybe by putting a leg or arm in an extreme position, or from pressure that lasts too long, either from how the patient is positioned or from the tourniquet they use to control bleeding.
Now here's where it gets really interesting. This risk, it's not the same for every surgery. The chances of a nerve injury change, sometimes dramatically, depending on which joint is being worked on. So let's take a look at the actual data and see what it tells us.
Okay, so take a look at this. This table breaks down the risk for the most common procedures. And right away, you can see a massive range. For the knee, it's incredibly safe. The risk can be as low as 0.01%. But as you go down the list, to the shoulder, the wrist, the ankle, the elbow, that risk just keeps climbing. And then you get to the hip, where the rate can shoot all the way up to 6%. That's a huge difference.
And this isn't just a random jumble of numbers. No, when you actually look at them, a really clear and important pattern starts to pop out. The key is understanding the difference between the two extremes we just saw.
First up, you have the knee. It's the most common orthopedic surgery done in the US, and surgeons have been perfecting the technique for decades, since the 1980s. The whole procedure is just so well understood, and the risk of nerve injury is practically microscopic.
And then you have the hip. Hip arthroscopy is a much, much newer procedure. It's way more complex, and it requires a ton of force, traction, just to open up the joint space to work. And all that complexity, well, it translates to a much higher risk, up to 6%. That's literally hundreds of times higher than for the knee.
And that right there, that's the key finding from the research. The risk is directly tied to how new the procedure is and how much experience the surgeon has. Newer, more complex surgeries, like for the hip, elbow, and ankle, they just have a longer, steeper learning curve. And that, unfortunately, leads to a higher rate of these kinds of nerve complications. But okay, let's say an injury does happen. What does that actually mean for the patient? It's really important to note that nerve damage isn't just one thing. There's a whole spectrum of severity. And the good news is, not all of it is permanent.
So the mildest form is called neuroapraxia. The best way to think about it is like a nerve bruise. The signal gets blocked for a little while, but the nerve itself, its structure, is totally fine. This is the most common type of injury, and the great news is that recovery is usually complete and happens all on its own. It just takes time, anywhere from a few weeks to a few months.
The next step up is axonotmesis. Now, in this case, the inner nerve fibers, the axons, are actually torn, but the protective outer layer of the nerve is still intact, and that sheath can act like a little tunnel or a guide for the axon to regrow. So spontaneous recovery is still possible, but it's a much, much slower process, and it's not quite as certain.
And finally, you have neurotmesis.
This is the most severe injury. We're talking about the nerve being completely cut in two. Because that connection is just gone, there's no path for it to regrow. Spontaneous recovery is impossible. Without another surgery to actually repair the nerve, the disability is permanent.
So with all that in mind, the focus for any surgical team is really two things. First, do everything possible to prevent these injuries from ever happening. And second, if one does happen, have a very clear plan to manage it.
Prevention really comes down to discipline and deep expertise. It starts with having a rigorous respect for the surgical technique. That means being almost obsessive about how the patient is positioned to make sure there's no pressure or stretching on the nerves. It's also about knowing the anatomy inside and out, like the back of your hand, so you can place portals safely and avoid any extreme positions. And like we already saw, nothing replaces the surgeon's experience.
But hey, even with the best precautions in the world, complications can sometimes still happen. And when they do, the medical team doesn't just wing it. There's a standardized, evidence-based protocol they follow to manage the situation.
The most important thing to understand here is patience. The standard of care is basically a watchful waiting period of 6 months. And why 6 months? Well, because like we just saw, many nerve injuries, especially that bruise type, neuropraxia, can heal on their own. So the process starts with tests like an EMG about 3 weeks after surgery to see what's going on. Physical therapy starts right away to keep the muscles working. Then they just monitor. And only if there's zero sign of recovery after 6 whole months do they start to consider a second surgery to try and repair the nerve. And this kind of brings us to our final thought. Arthroscopy is amazing, right? It's a huge win for patients, a real testament to medical innovation. But as we keep pushing the boundaries, making procedures even more complex and even less invasive, we have to stay on our toes. The benefits are right there in front of us, but the risks, well, they can be hidden. The real challenge is to keep that drive for innovation going while also holding on to the hard-won wisdom that helps us prevent these unseen complications in the first place.